I am 1,000% sure that I am pregnant. My family says I'm crazy, but I know I'm pregnant. No doctor has been able to figure out what's going on. None of them know what they're doing.
I would like to welcome our next guest. She is showing signs of pregnancy, but there is no baby. She believes she is pregnant despite all the evidence that shows she is not. Please welcome Stephanie to the stage.
Thank you, Dr. Phil. Thank you.
Thank you for joining us. So, Stephanie, you say that you're pregnant, but all the tests show that you are not. What do you think is going on?
These doctors don't know what they're doing. Nobody wants to help me. I've been gaining weight, my breasts are tender, and I haven't had a period in 7 months. What else could be going on?
Stop. This is common in women with pseudocyesis, which is a clinical syndrome in which a non-pregnant woman manifests with a firm belief of being pregnant in association with symptoms and signs that mimic the experience of being pregnant. The term was first introduced by John Mason Good in 1823. Until then, false pregnancy was the name most often used. The earliest theories concentrate on a physical basis for the condition, while more recently the psychological side has been in greater prominence. In the past, pseudocyesis has been reported as rare, but in developing countries is considered fairly common. It is a reported occurrence rate in Africa of 1 in every 344 pregnancies. The rate of pseudocyesis in the United States has declined significantly in the past century. In the 1940s, there is one occurrence for approximately every 250 pregnancies. This rate has since dropped to between 1 and 6 occurrences for every 22,000 births.
So, what does your family think of this? Do they believe you?
It's been really hard because everyone tells me I'm wrong and no one believes me. But my sister is starting to come around.
So, Stephanie's sister is actually here in the audience today, and I'd like to welcome Erin to the stage, ask her a couple questions. Come on out, Erin. Hey, Dr. Phil. Hi, thank you for joining us, Erin. Hopefully you can make some sense of all of this.
Thank you.
So, Erin, I would like to ask you, what exactly do you make of all of this?
Honestly, at first I thought she was crazy.
Yeah.
How could she be pregnant if there's no baby in there?
There's not.
But her baby bump is starting to show, and she's getting morning sickness, so I'm not sure what to make of it. I mean, we even hosted a baby shower for her.
Come on, did you really?
I need baby things.
You are wasting money, taking things from other people, taking your...
I am pregnant.
You need to open your eyes. This is ridiculous. You need to open your eyes. Are you guys kidding me?
What is this, Dr. Phil?
Stop. It is generally believed that pseudocyesis is caused by changes in the endocrine system of the body, leading to the secretion of hormones that cause physical changes similar to those during pregnancy, possibly caused by pheromones that increase estrogen, prolactin, and cortisol levels. Along with this, women with pseudocyesis may have a deficit in the brain dopamine activity. This fact supports the notion that pseudocyetic women may have a dysfunction of the central nervous system involved in the regulation of anterior pituitary hormone secretion.
So, Stephanie, I would like to get to know you a little bit more, see if maybe we can figure out what exactly is going on. Do you currently have any kids?
I don't. I've actually had 2 miscarriages, and so those were really hard, but I would really like to have a baby.
Well, and I think that must have been really hard for you, but I think maybe you manifested this into something it's not. I mean, you wanted the baby, you didn't have the baby, so now you're making up the baby.
Kind of the way you make up having a license.
Stop! Issues that may create pseudocyesis include miscarriage, usually more than one, infertility, or loss of a child. The conflict theory is often used to explain these causes of pseudocyesis. The conflict theory suggests a desire for or fear of pregnancy that causes internal conflict resulting in endocrine changes. Pseudocyesis is mostly found in women ages 20 to 39 that have struggled with these issues. However, some cases have been described in premenarchal and postmenopausal women.
I am actually pregnant. There is a baby inside of me.
Come on.
I don't care what
This
you
is
have to say.
pathetic.
You're not even a real doctor.
pathetic.
Like, this is not a thing.
Open your
I
eyes,
don't. No,
Stephanie.
I'm done. I'm done talking to you.
To try to show Stephanie that she's not actually pregnant, and to snap her out of all of this, we sent her to a leading gynecologist who's delivered 10,000 babies. So I'd like to welcome Dr. Atterbury to the stage.
Thank you.
Good evening. Thank you for joining us, Dr. Atterbury.
Thank you for having me.
Yeah, so you examined Stephanie. What did you find?
So we actually ran multiple pregnancy tests, both blood and urine, and both came back negative. We then did a sonogram, and I did not find a fetus in the uterus.
Well, it's there. You just don't know what you're doing.
So, Dr. Atterbury, did you find anything unusual that may be contributing to this?
I did actually. It appears that Stephanie is suffering from polycystic ovarian syndrome. The endocrine traits of pseudocyetic women resemble those of polycystic ovarian syndrome. Both experience weight gain, abdominal swelling, and menstrual disturbance.
Well, that's great. Now that we have found out that it's not a pregnancy, we can actually treat what's going on.
Except for that's not what's going on. She's obviously a crackpot who doesn't know how to do her job.
Stephanie, you are seeking attention by letting this go on. You've let your sister have a baby shower. Your family has spent money. Your family feels that you've let this go on too long. A very well-known gynecologist is telling you that you are not pregnant. You need to snap out of it.
I'm not seeking attention. You asked me to come on this show, not the other way around.
Wrong. Actually, Stephanie probably never fully processed her 2 miscarriages. Psychiatric evaluation may be appropriate and valuable with a focus on depression, anxiety, and marital problems along with psychiatric intervention as needed. It is important for the professional not to minimize the reality of the physical symptoms and to help the patient's body and mind get back in touch with reality.
You need a reality check, Stephanie. I think it would be wise for you to start seeing a psychotherapist. I mean, we just need to help you guide through all of this, help you come to terms that this is actually a medical issue, and it needs to be treated.
It does. It really does.
That's not what's going on here. I'm not a crazy person. I am for sure pregnant, and I've been pregnant before, so I know what it feels like. It's my body, and I know what's going on with it. I'm done with both of you.
Alright. Do you need some help?
Yeah,